Hello and welcome back to my channel. Today we're going to talk about a condition that often flies under the radar but can have serious consequences if not detected early: hemochromatosis. Whether you've been diagnosed with it, have a family history, or are just curious, this video will walk you through everything you need to know: what it is, the symptoms to watch out for, how it's diagnosed, and how it's managed. So let's get started. Hemochromatosis is a condition where your body absorbs too much iron from the food you eat. Normally, our bodies regulate iron absorption carefully, only taking in what's needed and getting rid of any excess. But in people with hemochromatosis, this control system doesn't work properly. The result is that iron builds up in the body over time, and that excess iron can deposit in organs like the liver, heart, and pancreas, potentially leading to serious health issues. There are two main types of hemochromatosis: primary hemochromatosis, which is inherited, and secondary hemochromatosis, which is usually resulting from another medical condition or repeated blood transfusions. In today's video, we'll focus mostly on primary or hereditary hemochromatosis, since that's the most common form. In hereditary hemochromatosis, the most common cause is a mutation in the gene called HFE, particularly a mutation known as C28-2Y. This gene helps regulate iron absorption. When someone inherits two copies of the faulty gene, one from each parent, the body ends up absorbing more iron than it needs, day after day, year after year. Interestingly, not everyone with this gene mutation will develop symptoms. Some people have what's called genetic predisposition without ever getting sick. But for those who do develop symptoms, early recognition can make all the difference. Now, let's talk about symptoms. Hemochromatosis has a reputation for being sneaky. That's because in the early stages, it often doesn't cause any symptoms at all. When symptoms do appear, they can be vague and overlap with many other conditions, which can delay diagnosis. Many people are only diagnosed after routine blood work shows abnormal results, or after they develop complications from iron overload. Some of the early signs include fatigue, joint pain, especially in the hands, and a general feeling of being unwell. Some people may notice their skin becoming bronze or gray in color, a change that happens gradually over time due to iron deposition in the skin. As the iron overload progresses, it can start damaging organs. If it affects the liver, it may lead to hepatomegaly, which is an enlarged liver, and even cirrhosis, which is scarring of the liver. Liver damage can increase the risk of liver cancer, particularly hepatocellular carcinoma. If iron builds up in the pancreas, it can interfere with insulin production and cause diabetes. When it affects the heart, it can lead to irregular heart rhythms or heart failure. In men, excess iron can interfere with hormone production, leading to low libido, erectile dysfunction, and even testicular shrinkage. Women might notice their symptoms later in life, often after menopause, because menstruation provides a natural way to lose iron every month. So, as you can see, the symptoms of hemochromatosis are varied and can be subtle for years. That's why early diagnosis is so important. The first clue often comes from routine blood work showing elevated ferritin levels or high transferrin saturation. Ferritin is a protein that stores iron, and transferrin saturation tells us how much iron is bound to the transport protein transferrin. When these numbers are elevated, doctors may suspect iron overload and order further testing. The next step is usually genetic testing. A blood test can check for the most common mutations in the HFE gene, C28-2Y, and another mutation called H63D. If a person has two copies of the C28-2Y mutation, that's the most common genetic pattern associated with full-blown hereditary hemochromatosis. Sometimes imaging studies like MRI can help assess how much iron is stored in the liver, and in certain cases a liver biopsy may be done to assess liver damage and iron concentration directly, though this is less common now due to advances in non-invasive imaging. Doctors may also check liver enzymes, glucose levels, and hormone levels to evaluate whether any organ damage has already occurred. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, once the diagnosis is confirmed, the next step is management, and the good news is that hemochromatosis is very treatable, especially when caught early. The cornerstone of treatment for hereditary hemochromatosis is a procedure called therapeutic phlebotomy. This is very similar to donating blood. The idea is simple. By removing blood regularly, the body is forced to use up excess iron stored in the tissues to make new red blood cells. This gradually brings iron levels down to a safe range. Initially, phlebotomy might be done once or twice a week, depending on how high the iron levels are. Over time, once the iron stores are reduced, the frequency can be decreased to once every few months for maintenance. Some patients may feel better fairly quickly after starting treatment, especially those with fatigue or joint pain, but it's important to know that some complications like liver cirrhosis are not reversible. That's why early detection is key. For people who cannot undergo phlebotomy, perhaps due to anemia or heart disease, another option is iron chelation therapy, which involves medications that bind to iron and help remove it from the body. This is less commonly used in hereditary hemochromatosis, but may be helpful in certain situations, especially in secondary hemochromatosis, like in patients receiving frequent blood transfusions. In addition to removing excess iron, lifestyle and dietary changes can help manage the condition and prevent complications. People with hemochromatosis are generally advised to avoid iron supplements and vitamin C supplements because vitamin C increases iron absorption from the gut. They should also be cautious with iron-rich foods like red meat and limit alcohol intake, since alcohol can accelerate liver damage. Interestingly, regular consumption of tea and coffee with meals may actually reduce iron absorption because of compounds called polyphenols. So, while moderation is key, some dietary strategies can support medical treatment. Family screening is another important part of managing hereditary hemochromatosis. Since it's a genetic condition, close relatives, especially siblings and children, may benefit from testing even if they feel perfectly healthy. Early testing can catch the condition before symptoms or complications appear. Now, let's talk about prognosis. When diagnosed early and treated properly, people with hemochromatosis can live a normal lifespan with minimal complications. The key is regular monitoring and staying on top of treatment. That includes keeping up with maintenance phlebotomy, checking ferritin levels periodically, and screening for organ damage if there are symptoms or lab abnormalities. If cirrhosis is present, additional monitoring for liver cancer is needed, usually with imaging every 6 months. For people without liver involvement, the risk of cancer is much lower. So to recap, hemochromatosis is a condition where the body absorbs too much iron, and this excess iron can damage vital organs over time. It's most often caused by mutations in the HFE gene, and while it often goes unnoticed for years, it can lead to serious health problems like liver disease, diabetes, heart issues, and hormone imbalances if left untreated. The good news is that it's detectable with simple blood tests and very treatable through regular blood removal or phlebotomy. With early diagnosis and proper management, most people can avoid serious complications and lead healthy lives. If you or someone in your family has hemochromatosis, or if there's a family history of liver disease or early onset diabetes, it's a good idea to talk to your doctor about screening. Catching it early really does make all the difference. Thank you for watching. As always, take care of yourself and make the most of your day.